Hello everyone, Helen the Health Librarian here, and on this episode of Health ABCs we will be discussing something rather taboo, and that is the STI chlamydia. So you might be wondering, what is chlamydia anyway? Chlamydia is a bacterial infection that is sexually transmitted. The scientific name for the bacterium is Chlamydia trachomatis. Any sexually active person is at risk, especially individuals with multiple partners. Chlamydia can lead to a host of serious issues, including damage to the female reproductive system, which can cause infertility, and ectopic pregnancy, which is pregnancy that occurs outside of the uterus. Here is an image of Chlamydia trachomatis bacteria to help you get a better idea. Chlamydia is spread through sexual contact. You risk contracting chlamydia anytime you engage in sexual activity with another person that is infected, and especially when engaging in unprotected sex. It is important to realize that having it once doesn't make you immune. You can become infected multiple times. Another way that chlamydia is spread is from mother to child. Babies can, in fact, contract chlamydia from their mother during birth. To detect chlamydia, discharge from the urethra in males and the cervix in females is collected. Alternatively, urine can be collected. Fluorescent or monoclonal antibody tests, DNA probe tests, and cell cultures may be used to detect the presence of Chlamydia trachomatis bacteria. Interestingly, up to 25% of men and 70% of women are completely free from symptoms. Men that do have symptoms may feel burning upon urination, pain in the testicles, penile or rectal discharge, or pain in that area. Women also might experience a burning sensation upon urination, pain during intercourse, discharge from or pain in the rectum, show symptoms of pelvic inflammatory disease, salpingitis, which is inflammation of the fallopian tubes, or hepatitis-like issues involving the liver. Abstinence is the only sure way to prevent getting chlamydia. Using condoms properly greatly reduces the risk, however. Sexually active females 25 and under should be routinely tested, and then women over 25 should be screened when they acquire a new partner or if they have more than one partner. Another way, having sex with only one partner who has test results to confirm the absence of STDs is another way you can prevent getting chlamydia. The typical treatment for chlamydia are antibiotics like tetracyclines, azithromycin, or erythromycin. Um, Other STIs should be screened for as well and treated if necessary. Follow-up testing may also be scheduled to ensure that the infection is no longer present, usually after about 4 weeks. Chlamydia tends to affect a woman's body more harshly than a man's. If it's not identified in its early stages, it can travel to the fallopian tubes or the uterus and cause diseases, again, like pelvic inflammatory disease or salpingitis. These can render a woman infertile. These conditions also increase the chance, again, of ectopic pregnancy, which is pregnancy outside of the uterus, and it's the number one cause of maternal death in the first trimester. It accounts for 10 to 15% of total maternal mortalities. Chlamydia is surprisingly common in the eyes. It's known as chlamydia-related conjunctivitis. It often occurs in infants and at birth due to the mother's uterus being infected. Um, it's also notable that chlamydia it disproportionately affects different races. The upcoming images illustrate prevalence statistics regarding chlamydia. The first is a graph showing differences by race, and the next two are CDC maps showing prevalence by state. The first map is from 2007, while the other is from 2009. This chart shows that non-Hispanic Black individuals are most likely to be affected. You might notice that DC's rate is very high, while New Hampshire's is very low. Notice how Louisiana's rate jumped from 452 to 626 in just 2 years. Thanks for tuning in, and be sure to watch next week's episode. D is for dementia.